Hey guys, this is Dr. Nimra Memon. Hope you are all doing well. Here I am again with you with another interesting topic that is pelvic inflammatory disease. Before heading towards the video, please subscribe my channel and hit the bell icon. Pelvic inflammatory disease or PID is an infection of upper female reproductive system including uterus, fallopian tubes and ovaries. It can cause a number of serious complications, including infertility. The female reproductive system includes all of the internal and external organs that help with the reproduction. The internal sex organs are the ovaries, which are the female gonads, the fallopian tubes, which are two muscular tubes that connect the ovaries to the uterus, and uterus itself large muscular sac where the fetus can develop in. The neck of the uterus is called the cervix. It protrudes into vagina. At the opening of vagina are the external sex organs which are usually called as genitals. They include labia, clitoris and mons pubis. The vagina, uterus, and fallopian tubes all have a mucous membrane, which is the layer of epithelial cells which lines the inside of these organs. PID usually develops from the bacterial infection in the vagina and the cervix, which can cause inflammation of the mucosal layer. About 60% of the time, this will change the composition of the bacterial flora in the vagina, also called the bacterial vaginosis. Because the reproductive tract is essentially one long tunnel that starts at the ovaries and ends at the external sex organs, the infection can travel up that tract pretty easily, and some mechanisms can make this even easier. For example, the cervical mucus, which normally act as a barrier preventing the bacteria to enter into the uterus, become less effective. The mucus can become thin as a result of normal variations throughout the menstrual cycle, or alternatively, it can become less effective in the context of bacterial vaginosis, which is when normal flora is altered, anaerobic bacteria degrades the cervical mucus. Factors that contribute to the infection is the retrograde menstruation. That means the menstrual blood spill from the fallopian tubes and still into the pelvic cavity, and it also causes because of the sexual intercourse. PID most problematic when infection reaches the tubes and causes salpingitis. It also affects the ovaries and causes salpingo-oophorytis. Infection triggers the normal response of the body, which sends neutrophils, plasma cells, lymphocytes into the fallopian tube. That sounds like a good thing, but it damages the tubal epithelium and fills it with the pus. When scar tissue forms to repair the damage, area of the damaged epithelium stick to each other, creating closed off pockets and dead end pouches in the tubes. Scarring can lead to the number of the complications related to PID. If pus fills in the ovary and the tube, that turns into the tubo-ovarian abscess, which is a life-threatening condition if ruptures. If the watery fluid builds up in the pocket created by the scar tissue, it can cause hydrosalpinx. It can cause affected areas to be swollen. In general, because of the structural damage it creates in the fallopian tube, individuals who have PID tends to get more difficulty in getting pregnant and have higher risk of ectopic pregnancies and chronic pelvic pain. Another complication is FITZ-HUGH-CURTIS syndrome, which occur when the inflammation of the pelvic inflammatory disease spreads to the peritoneum, from where it travels to the Glissen's capsule which surround the liver. This results in a violent string adhesions, a string of scar tissue that attaches the liver to the peritoneum. Bacteria are associated with the pelvic inflammatory disease. Neisseria gonorrhoeae is the most common one, and the chlamydia trachomatis, which are responsible for the sexually transmitted infection. Occasionally, PID caused by the other forms of bacteria which are introduced to the reproductive system by surgery, abortion, and normal vaginal delivery. Most of the time, infection is caused by only one type of bacteria, and in 30 to 40%, it becomes polymicrobial. Essentially, the original infection makes it easier for other bacteria to settle into the reproductive system. Because of the relationship with chlamydia and gonorrhea, sexually active females, particularly those having multiple partners and not using protection, are most at risk for PID. Most women has few or no symptoms, and some women has pelvic pain, tenderness around the ovaries, fallopian tubes, fever, and abnormal vaginal discharge. Of pelvic inflammatory disease is usually based on the clinical findings, particularly pelvic pain and cervical motion tenderness, which is when we mobilize the cervix, which causes the pain and discomfort during vaginal examination. Tenderness in the right upper quadrant in the abdomen is also a common finding if FITZ-HUGH-CURTIS syndrome has developed. No specific test, but there are some tests that support the diagnosis, testing vaginal discharge for signs of the bacterial vaginosis, nucleic acid amplification test to look for the chlamydia plus gonorrhea DNA from a sample taken from vagina and cervix or during laparoscopy of the fallopian tubes. Ultrasound will aid in the diagnosis if there is hydrosalpinx and tubo-ovarian abscess. Treatment. Antibiotics, ceftriaxone, cefotetan for 14 days, followed by 14 days of oral doxycycline plus metronidazole for the treatment of the bacterial infection responsible for the pelvic inflammatory disease. Acetaminophen can be given to manage the pain until the antibiotics treat the infection. Occasionally, surgery is needed to remove the adhesions causing pain or treat the pelvic inflammatory disease complications such as tubo-ovarian abscess and hydrosalpinx. Let's have a quick recap of the pelvic inflammatory disease. It is the infection of upper female reproductive system which causes the inflammation of the mucous membrane, particularly of the fallopian tubes, damages the epithelium and causes scarring and adhesions. It is caused by the most commonly Neisseria gonorrhoeae and Chlamydia trachomatis, which causes the bacterial infection. Complications include the infertility, ectopic pregnancies, and tubo-ovarian abscesses. That's all about PID. Thank you for watching my video. If you find this video useful, kindly like, share and subscribe.